Very warm welcome in our Maha Clinic for Integrative Medicine and Integrative Dentistry. We will take a short tour in our medical part at first, so please follow me. So this is our reception area. Here is your first contact with our receptionists, our staff. Behind you see our remedies. And here we have our waiting area. Waiting area is divided into different parts, so you can find your privacy, as you will see later on. Maybe we should begin with the most important part of our clinic. This is our gym. At the moment we are hosting a workshop on postural medicine connecting to temporomandibular diseases. Otherwise it is used to do yoga, pilates or other stuff. And of course here on this part we have more equipment for running and to do postural treatments. I call it medical personal trainings because it's oriented into treating posture problems that people have, or our patients normally lack the tone in the muscles, they would like to gain weight, and all they know how to gain weight is through eating not appropriate sugar, and they gain weight in fat, not in muscles. So it is extremely important that we give to our patients the knowledge how to increase the muscle mass, and that is the healthy mass that the people should have. Okay, follow me. Here our integrative medicine combines bioregulatory or biological medicine and Ayurveda, including manual therapy, of course dentistry we will see later on. So this room here is dedicated to doing Ayurvedic treatments. They are called Panchakarma or five points therapy, which we combine with infusions and other technologies that I will show you in the other rooms. So here you see this is the barrel for steam bath, steam sauna with of course water and herbs, and here are all the modalities done regarding the Ayurveda. Next room is more dedicated to, well, of course, also we can do Ayurvedic treatments here. Normally we do Indiba therapies like local hyperthermia, or included in the manual therapy sessions, and of course really important Mitovit, so EHHT therapy. Basically we measure practically to every patient BHI index, and I must say that mitochondria are really not working. Maybe even I have a famous sportsman as our patient, and at the end of his season his mitochondria were not working at all. So we are preparing him now for the next year, and well, I say next year we win. Actually he's my friend. We also do infusions here, as you see, the infusion stands, upbuilding, detox, restitution, different kinds of infusions, curcumin, etc. Many of our dental patients, since we grew out of dentistry, so many of our dental patients after or prior to surgeries get the infusion treatments. And then in this room here, this is the room from our psychotherapist. He's doing the Young's approach a little bit on his own way, and he does this scent play therapies, which is extremely interesting. I never knew about that before. The patient makes a scene, and then through this scene they do the analysis. I said I must take it one day. Well, he says I cannot treat the people that I'm close with, but still I would like to play with sand. When I come here with my children, always they want to be in this room. Okay, to continue, this is our aerotherm room. So many of you, I would say, know the aerotherm. This is a systemic hypothermia, extremely effective in all the cases. Actually, it's a really good detoxification therapy and immune system upbuilding, and everything is of course done according to the protocol. You see our staff is still here, the computer is on, and we are still, even on Friday at 5 o'clock, we are still active. Then maybe we go zigzag. This is room from our Ayurvedic doctor, and also he has all the remedies here, so he can explain to patients, the examination table. And of course, if we are fully booked, we do some treatments also here in this room. This is our papimi room, so with the pillow and the machine. We have 2 papimi devices. This is one of them. Really interesting is this chair always, because it's for the prostate problems with the hole. We just pull the applicator inside, you sit, and then you get the treatment on the prostate. Here is my room. Here I do the first consultation, whether being medicine or dentistry. I share it with our internistic oncologist, she now began to work with us. I'm extremely happy about that, and now we can really integrate the oncology, regular and integrative. You can see here I just have new posters I need to put on the walls. Patients are really always interested, of course, when we see what is inside our bodies. It's easier for us to decide for the treatments. So normally all the patients say, I'm taking this vitamin, that mineral, and then we do the simple analysis of minerals and basic vitamins, and they say, oh, I'm taking all the wrong stuff. No wonder why it doesn't work. So really we should also the supplement part, orthomolecular, we should approach medically, so with the blood analysis, so we know exactly what to prescribe to patients. I do a lot of dark field. I'm a student of Thomas Rauch. He taught me very well on how to do it, and especially how to interpret it. This room here, we call it Earth. It's named according to Feng Shui. Is another papimi room, and also normally we have that bed from the workshop here. So it's our room from our manual therapist. So he does the therapies here, because also in manual therapy papimi is really frequently used. And on the other side of the hallway, it's our ozone room. We have 2 ozone machines. One currently in service, and basically this concludes the tour of the medical part. Well, the important part, the CBCT machine. We will now get a new one with a bigger field of view, so we also can check the joints and everything. But I think this green technology is really low exposure, low radiation, so the technology is really advancing, and really we can always have this cone beam CT, cone beam 3D, which is really very much more accurate than normal panoramic, and I think that every once in a while you should take this X-ray in order to see that everything functions just right in your mouth. So here the reception is more cozy, and well, this is where you come in and you are accepted. I really like the design. The architects made this so you can really have your privacy. You go inside and you have your own piece. Of course, everyone is nervous before going to the offices. So this is, for example, this is where I perform surgeries. I'm waiting now for the new surgical chair. You see we have a lot of screens, we have a camera in the microscope, so if wife comes with the husband or vice versa, they can look at the operation live on the screen on the wall. All the time we use ozone to disinfect the wounds. So extremely important device which is used when we safely remove metals from the mouth, especially amalgam, since it has this large diameter hose that we bring near the mouth, and all the aerosol that is coming out during drilling is sucked away, so we don't contaminate all the room, and of course we protect our dentists and their assistants. Maybe just for sampling, this is another dental office. All are equipped with microscopes, and basically they look the same. You can, well, even have a peek at our backstage. This is our sterilization area. So the dirty comes here and then it goes to the clean there and into sterilization. So everything is as it should be. We also have a possibility of sedation therapy with nitrous oxide. It's not so healthy, but if you do it once in a while, still the anxiolytic effect is really good and the patients accept it well. And it's of course easier to do the procedures. So altogether we have 6 dental offices that are really similar. All the time we are changing our material, and we really take care that every patient not just looks at the beautiful picture but gets some educational information. This one is about ceramic implants. So 98% long-term success rate, less inflammation of soft tissue, and lower inflammation reactivity of ceramic implants, for example. This is where our orthodontist works, and this is more of the occlusion therapy here, but the offices look the same, yeah. And this is for our dental hygienist's office. You can see the laser there that I was showing on the lecture. And this is our lab, one part of our lab. This is where we do the manual stuff. At the moment we are doing the a splint for a patient. This is how it's done. This is our meeting room, and we also sometimes play guitar between patients. Normally there is a large screen here. We are now using it. Well, the dentist oftentimes during the treatment we use this machine just to go on the head and stretch a bit, because we are all the time in this forced position. We also have dark field microscope here. On this one we also have a heating stage. Heating stage means that we heat the table to the body temperature. So, and then we can normally still the sample inside. When a patient has periodontal disease or during surgery, if something interesting, we do the dark field of the biofilm from the mouth. And then sometimes really interesting stuff comes out. We just made a plan to perform a minor in-house study on the biofilm composition in different systemic diseases, and we'll see if we can get any correlations. For the patients, this is very important room. This is where sometimes where our patients are already used to it. So when we make all the diagnostics and all the acute therapies so that we relieve the pain, Then we do the photographs, we do the bite analysis, we do the scans, we do the CTs, and we make a PowerPoint presentation for each patient. And then we sit down in the office, we project it under this big screen, and then we say, this is your problem, this is your problem, this is your problem, this is your solution, this is your solution. And of course we talk about finances here, and according, basically, since the insurance mostly doesn't cover everything, when we then discuss the dynamics of the treatment. So every patient can afford, it just depends if he's doing it all in 2 months or he can take 2 years, and then we take the more important stuff first, for example, infections, non-infectious inflammation, and then slowly we come to an end. And this is really important. When the patients see their teeth on the screen, then normally they can understand what we see in the mouth and why a dentist suggests some treatment. Because if you are just talking in the office without people to see, then they say, but I don't feel nothing, why I should do that? Well, just because in order to prevent that you will feel something at some point. And it's a really, most of the times it's a really nice discussion, and it's really nice when we say when a patient becomes the owner of the problem. So it's not the therapist's problem, but it's the patient's problem, and then of course we find a strategy. And the room is called the room of ideas.